Hi everyone, my name is Maya Nazinski and this video is going to be called Bias in the Birthplace. So my placement is at Claremont Regional Medical Center and usually I work in the emergency department, but sometimes when it's slow I'll go over and work with the social worker who works in the birthplace. And the birthplace is comprised of the labor and delivery unit and the neonatal intensive care unit. And if you don't know what that is, that's where newborn babies with complex medical issues go once they're born, if they need special care that the nursery wouldn't be able to provide. When moms come in to give birth, they're sometimes drug tested and sometimes their baby's cord blood is drug tested as well. The main difference with this is that the cord blood can detect drugs over a longer period of time, whereas the regular drug test will only go back a couple of days or weeks. So if the mom used drugs 2 months before she delivered, it would show up in the baby's cord blood, but not her blood. Which leads to another problem, which is that the doctor who orders the test is different. So the doctor who delivers the baby, which is the mom's doctor, will order the mom's drug test, but the baby's doctor, once they're born in the NICU or the nursery, will order the cord test. So if one's not ordered, then there might not be an indication to order the other, and then something could be missed. So next we're going to talk about what determines whose bloods get tested and what determines whether the mom's blood, the cord blood, or both will get tested. Yep, absolutely nothing. There is no standardized procedure, protocol, anything to determine who gets tested or whether the mom's blood or the baby's blood get tested. It's completely up to the provider's discretion. So some patterns that I've seen are that babies whose cord blood gets tested often have mothers who have a history of drug use, are on Medicaid or have no insurance, are of low socioeconomic status, are frequent flyers, which means that they have high utilization of the hospital, usually in the emergency department. Is one of the things that they look at the most, are significantly older or younger than the average age at which women give birth, and are unemployed or have a low-paying job. So on Friday, I actually went and I looked through all the mothers' charts who were giving birth in the birthplace that day, and I went through and see who they ordered a cord or a drug test on. And it's shocking how much discrepancy there is in insurance status. I went through and I clicked on all the patients who had Medicaid, and every single one of them were drug tested, and some of them were cord tested, but mostly they were all drug tested. And then I went through and I looked at the ones who had private insurance, and almost none of them were drug tested unless they had a prior history. For example, there was a 15-year-old African-American girl who was going to give birth, and she was on Medicaid, and she didn't have a job, and so of course they drug tested her, but there was also a 20-something-year-old white woman who had Blue Cross Blue Shield, so they didn't drug test her. And then another thing, I went and I asked the nurses kind of what they thought, some patterns that they've seen. And they said the mothers who have the drug look often get both their blood and the baby's cord sent off. And then if the mother doesn't fit the picture of what a normal mother would look like, whatever that means, then their blood and or the baby's cord blood will likely get tested too. So I asked the nurses and the social worker what some other biases they saw were. And one thing they told me was that they have a lot of Hispanic mothers come to the US to deliver their babies from other countries. And that they're often judged either by the doctor or other nurses because they often come here with limited or no prenatal care, either because they don't have access to it or that that's just not something that's widespread or taught about. Another thing was that one nurse told me that she sees a lot of people treat moms who have a lack of healthcare knowledge as though they are slow or dumb. And then the nurses will gossip about that patient, and then the cycle will get perpetuated because then the rumor spreads that that particular patient is slow or dumb, and then they're just treated differently than other patients. Another bias they found was that the staff, meaning both the doctors and the nurses, will treat moms with substance use problems differently than other moms and will assume that they know what kind of parent they're going to be and that the mom will know how to parent their kid, which is not a correct assumption. The last thing was that the nurses and doctors tend to judge mothers if they are of low socioeconomic status and already have a lot of kids. So nurses have heard other nurses say stuff like, well, you already have 5 kids and you're poor. How are you going to afford this next one? So why is it a problem that there's no standardized procedure for drug testing moms or their babies' cords? First of all, it leads to the potential for bias, stereotyping, and judgment. And secondly, it's dangerous. If something's missed and the mom and or the baby are not tested because there's no clear indication for a drug test, then they send the baby home, and if there is something in the cord, then they could potentially be withdrawing from the drug at home, and that is dangerous because in a lot of cases, especially if they're withdrawing from benzodiazepines or opioids, it needs to be done over very close medical supervision because there is a great potential for danger for the baby. So my project would be to do some sort of like bias training or workshop in which I would give the doctors lists of pretend patients, and I would identify normal characteristics that they would have in their charts that they look at when deciding whether or not to do the drug test, like their age, their race, insurance status, number of kids, history, etc. And then I would ask them which patients they would test. And then once they filled that out, we would go over the lists and see common patients that the doctors chose, and then just kind of make them aware of the biases that they have, whether or not they realize it or not, and just try to really make them aware of that and have them try and use this information in the future when deciding whether or not to drug test the moms and babies. So the biggest barrier to this project is that people don't want to recognize their biases and they might feel judged or attacked. And then the second thing is that it might not even change anything. But the strengths are that it would be easy to implement, it wouldn't cost anything, and there is a potential for change. Even if it might not be as big as I would want it to be, there is some potential there. That's the end. Thank you for watching.